Thank you all so much for joining us for today's poison prevention webinar. We are so excited to welcome Jim Ginder, who is the health education specialist at the Hamilton County Health Department. My name is Jessica Carmen, and I am the community engagement specialist here at Childcare Answers. Childcare Answers is the local childcare resource and referral agency for Hamilton, Hendricks, and Marion counties. We are a nonprofit organization who help families get connected and find childcare, help them get connected to other community resources, put on workshops, and other things like that. Since we are a nonprofit, all of our services are completely free of charge. So if you have any questions or you would like to get connected, please do not hesitate to reach out to me. So Jim, thank you so much for being here with us today. I'm really looking forward to all the great information that you have to share with us, and I will hand it over to you.
Awesome. Thank you, Jessica. As Jessica said, my name is Jim Ginder, and I oversee the education division here at Hamilton County Health Department. And thank you all for taking the time to hang out with me today to learn about poison prevention. So we're gonna talk a lot about poison prevention because I think that's one of the big things that a lot of people kind of forget or put in the back of their heads when we talk about having little ones around the house, or also having other people in the house as well too. So this is what I want us to be able to talk about. So we're going to list three types of different poisons that are out there. We're going to talk a little bit about why kids are at increased risk of being poisoned as well too. We're also going to kind of review about some toxic plants. I teach this class a lot in the community, and a lot of people forget about our plants as well too. Then also, if we do need to call the poison center, what is some information that we need to provide the staff at the poison center as well too. And a lot of times what happens is if we call that poison center, the staff at the poison center can help us take care of that poison instead of taking that person to the hospital as well too. Then also we'll talk a little bit about the poison center number as well too. So I like this kind of cartoon. Those of you that have been around like I have, we know that this character has been around forever and ever and ever. And when we kind of look at the history of poison prevention and poison education, we know poison education and poison prevention has been around forever and ever and ever. And as I said a few minutes ago, I think a lot of people forget to think about poison prevention, about putting our pills up, about how to get rid of old medicine if we don't need that medicine. And we'll talk a little bit about that as well too. So we're kind of all on the same page. Let's talk a little bit about what poison is. So poison is basically any substance that can harm an animal or a person if it's used the wrong way, if it's taken by the wrong person, stored the wrong way, or taken the wrong way. So let's talk about the first one, used the wrong way. A great example is, let's say we're taking Tylenol, and the directions say you take 2 Tylenol every 4 hours. Well, the person takes 5 Tylenol every 2 hours. That's taken the wrong way. So we didn't follow what the instructions told us, taken by the wrong person. We see a lot of this here in Hamilton County. I oversee all the overdoses in the county as well. One of the things I think is so important is we only take medicine that's been prescribed to us and not give medicine to a family member or a friend, then also stored the wrong way. We'll talk about this a little bit later. And we know that some people may have a bottle of, let's say, bleach, for example, and there's not a lot of bleach left in the original container, and they want to get rid of the big container because it's taking up space. So they may put it in something else and forget to label that new product the bleach is in, and that could possibly cause a poisoning as well too. And we also talk about taking the wrong way. This could be maybe you're not supposed to take it with alcohol, or maybe you're supposed to take it with food, or maybe you are not supposed to take it with another medicine. Like a great example is grapefruit. There's a lot of drugs out there that cannot be taken with the grapefruit as well too. And then we also need to think about how these poisons get in our system. Well, ingested, that's when we're getting in our mouth and into our bellies. Inhalation in our lungs. Injection, that could be from an insect as well too, or it could be from a needle, spilled in our skin, or splashed in our eyes. So these are the most common ways these poisons get in our system as well too. And this is some data. And you can kind of see that every 30 seconds, a child is poisoned here in the US, which is pretty scary. Excuse me. And when we look at our data, it's usually kids under the age of 6. And we'll talk more about that in just a second as well, too. And one of the things I think it is really important is when we think about these accidental poisons, we know that that's when the child's routine has been changed. Like a great example, let's say you're going on a vacation, and you're going to a new place for vacation and the child isn't used to it. Or maybe you're going to aunt and uncle's house and aunt and uncle's on medication and they have not had a child in their house for a while, and they have not child made that house ready for those little ones as well too. And also what's really scary and sad is we know the number of poisonings are increasing here, in the US as well too. And something that could be simple as Tylenol or aspirin can poison and hurt those little ones or hurt anybody as well too. And one of the things I think is really important is you see this picture of a house, right? So what we need to think about are what are some poisons or what are some things in our house that could poison us as adults or even the little ones as well too. And a lot of people forget to think what also is outside, that can poison our little ones and our adults as well too. Could it be poison ivy, poison oak, poison sumac? Could it be a plant that you have out in the front yard? Could it be the insecticide or weed killer, that you're using on the yard as well too? Could it be the stuff those chemicals that we have in our garage as well too? So when you think about poison prevention, you kind of need to look at the big whole picture and kind of think about what do I have in my environment that could put myself or those little ones at risk for accidental poisons as well too. And we kind of talked a little bit about this at the very beginning about why kids are so um, interested in poisons or substances. Well, we know there's some characteristics of kids. We know kids are curious. We know they like to climb things. We know like they like to explore new things. We know they like to put things in their mouth because a lot of them may be teething. A lot of them helps with their taste bud development as well too. We know, again, as I mentioned, that taste bud development as well. A lot of times these little ones can't read, so they can't see or they can't see or read what the label says as well too. We know they drink everything, and we also know that these little ones also mimic our behaviors. So if we're taking medicine and these little ones see it, they may think that medicine may be M&Ms or a different type of candy as well too. And again, they have that hard time distinguishing what is the difference between medication and candy as well too. Like a great example, the Tide Pods. That was a big issue we had a few years ago as well too. That we're still seeing that happen, as well too. This is a great example, and a lot of people when I teach this class to the child development students at the high school, they laugh about this, and it is kind of funny. But we also need to think about some stuff as well too. This little one can basically drown, in this dog's water bottle as well too. And you see the green thing at the very bottom. A lot of people think that's a Lego, but it's not a Lego. Probably maybe some of you or some of your grandparents have it. This is a pill divider, and that's the Monday through Sunday thing where you can put your medicine in there. Well, if you're a 2-year old or 3-year old or even a 4-year old and you grab it, if there's pills in it, it sounds like a rattle. And you can pop it open really easy and you see that those candies in there and you take them. Another thing I think it kind of reminds me of is Pez dispensers as well too, because with the Pez dispenser, you push a button and the candy comes out. Well, with the pill dispenser, when you open it up, there's that candy in there as well too. So you really need to think about those things as well too. And I'm not going to bash ladies, but guys can also have man bags as well too. So if you do carry a purse or a man bag, think about all the stuff in there that could be poisonous to our little ones. And a lot of things that people do carry in their purse or man bags, if you notice, there can be some significant health risk. Like a great example, that perfume. A little one can get a hold of it and possibly be intoxicated as well too. Baby powder, it can be absorbed into the lungs as well too. And we also notice besides the chemical component or the poison component, also the choking hazards as well too. So just really important if you have a purse or man bag that we make sure it's zipped up or velcroed shut or however you shut it, and we put it up high so those little ones can't get it into their hands as well too, because we all know that they want to explore, they want to know what's going on, they want to taste, they want to feel lots of stuff as well too. And we kind of go back to those changes of the routine. And I think when you look at the different parts of the year, we know holidays is one of the big times when these poisonings happen because a lot of us go to maybe family or friends for the holidays, and maybe our family and friends haven't had those little ones around, and maybe their house isn't really prepared for those little ones as well too. Many times children are sick or someone in the family is sick, and we have medication laying around as well too. Moving to a new house, we talked about those vacations, those stressful times where we think we put that medicine up, or we think, oh, it's far back on the counter, there's no way they're going to get it. Well, unfortunately, if they want it, they'll find a way to get it as well too. Those celebrations as well too. Again, kind of the example of going to maybe somebody's house, but that house isn't child ready yet as well too, and also not child proofing that home. And we'll talk more about that here in just a second as well too. So here's some things we need to think about, and we kind of review this a little bit. When a product is being used the wrong way, when the product is being stored the wrong way, as you can see in my picture here, do we have any idea what these products are? We have no idea because they're not labeled, right? We also talk about people fail to read the instructions. So I'm a big fan of every time you bring a new chemical or a new cleaning product or whatever in the house, we always need to read those instructions because we know there's some chemicals that cannot be mixed with other chemicals. There's some chemicals that, I mean, you have a well vented room when you use them. Some chemicals we need to have gloves on as well too. Another thing we talk about is children who are visiting grandparents or others. We talked about that. Children are hungry and thirsty. People are depressed. We see that a lot with individuals who maybe have those suicidal ideations as well too. So I'm just a big fan of if we're not using medicine, we need to get rid of it. And I'll give you some examples of how to get rid of medicine the correct way as well too. Then also are individuals who become confused or disoriented. A great example that I always give is sometimes, let's say, if we have maybe a granny and grandpa who have taken their medicine and Fluffy the cat hops on the counter and knocks off maybe the pill bottles. Maybe granny and grandpa can't remember if they've taken that medicine or what medicine goes where, and they possibly poison themselves. Also, I think it's something that we really need to think about is if a person has more than one healthcare provider, making sure that each healthcare provider knows what medicine that person is on. Many times, healthcare provider A may not know what healthcare provider B put them on, so we may have a possible poisoning that way as well too. So when we talk about poisons, we can actually break them down into four categories. The first ones are sprays. That's pretty easy. Then we talk again liquids, pretty easy. Then we talk about solids. Then we talk about invisibles. And I think the invisible ones are kind of hard. These are things that we may or may not be able to smell or see, like vape pens is a great example. We know that a lot of little ones are getting hold of maybe their parents or older brothers' vape pens, and they're having an accidental poisoning with that as well too. Another thing we talk about with invisibles is maybe people bringing in their grill because it's getting a little colder outside. Maybe they bring into their garage and they shut the garage door, and we don't see that smoke or those chemicals coming from us cooking as well too. So, excuse me. So we really have to think about those invisibles. Another thing, it's starting to get cold outside with people starting their furnace. Maybe those individuals who have gas heat are starting to have a headache because they have that CO2 poison as well too. So these are some things that we really need to think about when we are dealing with poisons as well too. As I mentioned, how do these poisons get in our body? We talk about swallowing. We talk about inhalation, like from vapors. We also talk about skin to skin, eye contact, and bites and stings. You can see here, this is a great example of a stinger. Just remember, if somebody ever gets stung with a bee or wasp, take a credit card and flip out the stinger. Do not use tweezers, because what happens is if you use a tweezer or something to grab it with, you actually can squeeze them venom sac, and that venom can actually go into the body. So we want to use a credit card, a gift card, anything that we can to flip that stinger off that skin, and to prevent that venom from going into the body as well too. So this is kind of scary to me. These are things we talk about. What do poisons look like? Can poisons look like other things? And this is a great example. We have the blue Mountain Dew and the Windex. And if you're 3 or 4, you may not know. Then we have our pills and candy or gum. Then we also have our Mr. Clean and Gatorade, right? Then we have our Comet and Parmesan cheese for like spaghetti. Then again, our M&Ms and our medicine as well too. Then also, this is another one, the Kool-Aid juice boxes, and we see our Vicks and our Scope as well too. So we really need to think about with our little ones that things that we think they will not get into, they probably can as well too. And again, if these individuals are, or these little ones are used to getting, let's say, some Kool-Aid, if they come in for their snack or whatever, and you have the Windex on the counter, they may think that Windex is that Kool-Aid as well too. So that's pretty scary to me as well. These are some other things that I think is really scary as well too. And if you look at them, these are cartoons that usually every little one knows about. But if you notice, it's hand sanitizer. And another thing we need to think about is toothpaste. Toothpaste is a great example where a lot of times we'll see these same cartoons on toothpaste. Toothpaste could be toxic if they absorbed or they got a lot of toothpaste in their system. That's the reason why we always recommend for little ones that you make sure you get toothpaste for the little ones, because that toothpaste is traditionally not toxic to those little ones as well too. This is another great example of a minion that's a hand sanitizer as well too. So what are the most common types of poisons that we see? Well, we've talked a lot about this already. We talked about our cleaning products, our medication, our cosmetics, our health and beauty products, our plants, and our laundry products as well too. That's the reason why I'm a fan. If you have a little one, probably not a good idea to have Tide Pods or any type of pods around the house for your laundry or for your dishwasher. I'm more of let's use liquid for those, because we know that we can secure them a little bit safer than we can those Tide Pods or those cleaning pods as well too. This is another example, just to kind of give you an idea where things were mixed. This just happened in March of this year, where some students at a students that were in a kindergarten class actually were given milk, and the teachers thought it was milk, not a big deal, but it actually had a chemical in it and was actually a sanitizer. And for some weird reason, it was mismarked or mislabeled. And some of these kindergarten kids actually ended up in the hospital as well too. So pretty scary stuff. We also talk about these glow sticks. This is another big issue because a lot of our elementary kids and even our high school kids like these glow sticks. They're pretty cool. We know in a few days Halloween's going to be approaching. And we know a lot of people may give these out for Halloween gifts or just to be on the safe side, which they're great for identifying individuals. But this is the MSDS sheet, or what happens if that glow stick would break in that person's mouth as well too. So it's just really important that we kind of know that number to that poison center. So in case that would happen, that our friends at the poison center can tell us what to do as well too. Now, back in the day, one of the things that everybody said, everything was child proof. Well, that's not really true. You can see this little one trying to get into the medicine. We say that they are child resistant. So really nothing is child proof unless we have a padlock on the cabinet where that medicine or those products are. So child resistant means is if we give a child like a medicine bottle, within about 5 or 6 minutes, they're going to figure out how to open it. And a lot of people may have those cabinet locks on their cabinet as well too. But again, we mentioned earlier that our kids mimic our behavior. So if they see us opening that cabinet a few times, they're going to be able to figure it out. So when people say, well, my house is child proof, I don't know if I would say it's child proof, maybe child resistant. But we know these little ones, if they're determined to get into something, they're going to get into it as well too. We're going to watch this quick clip here. And so I think one of the things we need to think about is that you will notice a lot of the adults are laughing when they see this, and we know that's bad because the kids know that it's funny, so it's something that they need to keep doing. And as I mentioned earlier, once those kids see us doing it, then they're going to be able to do it as well too. This is another example of we need to be really careful. So this was a case where a individual thought that she was getting like the stuff for her contacts to like refresh her contacts, but she actually grabbed super glue instead and put the super glue in her eye and actually glued her eye shut as well too. You can kind of see in the middle there the contact when the contact was removed at the hospital as well too. So we really need to think about this stuff as well too. Another thing I think is really important, as I mentioned this earlier, our little ones can't read. So when a little one tries to read something, you can kind of see this is what they may see or their brain may think. But when we convert it as an adult, this is what we see, right? So that's the reason why it's so important to keep things up locked up, keep things up high, keep things locked up with a padlock. And if we're not using a medicine, we need to make sure that we get rid of it the safe way as well too. This is something that I think a lot of people forget to think about is what is poisonous, or what flowers do we have, or weeds in our garden or in our yard that we don't think about that can be poisonous. And some of you probably know some of these, but a lot of people maybe have a misconception. We know many years ago there was always a big thing where poinsettias, which we'll see those in a few weeks because of the holidays, that they were poisonous to people. Well, not really. They're more poisonous to animals than to people as well too. So I'm gonna give you a second to think about which ones are poisonous and which, or I should say toxic, and which ones are non-toxic. And I'll show you the answers here in just a second. So the answers are, here we go. So let's talk a little bit, let me back up for a second here. Let's talk about the dandelion for a second. Dandelions are not toxic unless there's a weed killer put on them. So like from a like True Green or some place like that who's come in and actually we pay them to kill dandelions. But if there's no chemical put on them, then they're perfectly fine. A lot of people use it for salads and tea and all that other type stuff. But we have to remember, was there a chemical applied to it as well too? So here's some things that we can do to think about what are some ways to lower our risk of accidental poisons. Again, read and follow all the directions when using the product. Make sure we read all the information. I teach a prescription drug course at the high schools, and I always talk about you need to read the package inserts. And when I say that, I get this blind look with these high school kids because they have no idea what I'm talking about. So I think it's really important that we read those package inserts when we get our medicine. And also, I think it's important that if our medicine comes with a pretty little stickers on the side of them, we read the stickers as well too. We also need to make sure that we keep all of our products that are toxic and dangerous up high and locked with a padlock as well too, to make sure nobody gets in those products as well too. We also talk about medication. I'm a big fan of not keeping medication in, let's say, the spare bathroom medicine cabinet, that we keep it all in one place and have bins. So let's say mom has medicine. So we put her medicine in a bin. Let's say dad or the partner has medicine and we put their medicine in a different color bin. Then we lock it up together and the kids have a different color bin as well too. We also need to make sure that all of our products we have are child resistant. And something that a lot of people don't know is individuals that have arthritis and our medicine can actually have the pharmacist put on a different lid. It's a pop-off lid, which is a lot easier to get into as well too. So that's something that we need to be thinking about as well too, and kind of have an idea what products in your house are poisonous. And if we are going to take a product from its original container and put it in another product or another container, that we need to make sure that we label that new container as well too. So I know a lot of you probably know how to read a prescription label, and I just think it's really important that we all understand how to read it, because if a poisoning does occur and you do need to call the poison center, they're going to ask you some of this information. So it's pretty important to know how many pills are in the bottle. So how many pills were prescribed, how many were left as well too, and then milligrams and what medicine it was. And I said the date that it's been filled as well too. That's really important. So this is just an example of a medicine cabinet. And I just think it's really important. And I keep mentioning this, that if we don't use medicine, we need to get rid of it as well too. That goes along with our pets medicine as well too, because we know a lot of time our pets are on medicine as well too. If our pets aren't using that medicine, we need to we need to get rid of that medicine as well too. One thing I think is really important is probably some of us remember back in the day when we were little, and we had like a sore throat or cough or whatever, and mom would always go to the drawer and pull out a teaspoon. Well, we really don't want to do that anymore because teaspoons come in all different shapes and all different sizes. So when it comes time to using or to giving medicine, we want to make sure that we use accurate forms of measurement. So the little cups that come with the medicine from the pharmacy, or the measuring spoon that comes from the pharmacy, or the ones we can get at like CVS or Walgreens that measures liquid medicine. So we need to kind of think about that as well too. And these are just some examples, as I mentioned. Also, one thing that's pretty important is we know that some adults and our little ones can't swallow pills. So before we cut up a pill, it's really important that we call the pharmacist and ask the pharmacist to see if we can do that. Because a lot of times our medicine cannot be crushed or it cannot be cut in half because it could change how that medicine is going to work. So before you crush a pill or before you cut the pill in half, make sure you call that pharmacist and see if it's okay to do that as well too. And if it's not, maybe that pharmacist can take that medicine and put in a liquid for you, but let them do that formulation for you and don't try it. I just think it's so important that we always, if we have questions about our medicine, that we really need to call the pharmacist because that's what they're there for, and they're there to help us with our medicine as well too. As I mentioned, if we are going to cut a pill, this is called a pill cutter, and it's a great tool that you can pick up at any Walgreens, CVS, Target, Walmart, any pharmacy as well too. And this will cut the medicine in half. Then the bottom picture, that's a pill grinder, and that actually grinds the pills into a powder that we can mix it in with food. We can mix in with drink as well. But again, before we do this, we really need to make sure that we call the pharmacist to make sure that we can do that as well too. So one of the things I think before we take medicines, it's called the R's. We want to make sure it's the right person. Is it the right time for us to take the medicine? Is it the right dose? Is it the right medicine as well too? And are we taking it the right way? Such as, do we need to take it with food, or do we need to take it on an empty stomach, or do we need to take it with water or juice or whatever? So I think it's really important that every time a person takes a medicine or gives medicine to their child, that we always make sure we read the label. Because let's say that we have multiple medications in the cabinet and maybe we grab the wrong medication. So I just think it's always important that we verify every time we take a medicine that we have the right R's as well too. One of the things we also talk a little bit about, as I mentioned a few slides ago, about our plants outside. As you notice, these plants are labeled as well too, right? So we know what the plants are. Um, I can disclose this to you that I know what some of the plants are in my yard, and some of them I have no idea what they are as well too. And I really need to figure out. I know there's some different apps out there that you can download for free that you take a picture of it, and I'll tell you what it is as well too. And I don't know if you can see the one of the plants here. You see the little skull there. That means it's poisonous or toxic to kids or to our animals as well too. So just make sure we kind of know what plants we have around the house as well too. One of the things I think is really important when we talk about poison prevention is we always need to think about who we need to call. So the philosophy is, if the person is acting okay, so they're not having trouble breathing, they're not having a seizure, they're not having difficulty breathing, it's really okay to call the poison center. And I'll give you that number here in just a second. But if you have somebody who is unconscious, they're having trouble breathing, they're acting a little different or kind of weird, I want you to call 911 and put your phone on speakerphone as well too. Okay. So if the person is unresponsive, they're having trouble breathing, they're having a seizure, or they're acting strange, I don't want you to call the poison center. I want you to call 911 immediately. Okay. And put your phone on speakerphone as well too, because my dispatch friends at our 911 center will be able to help you as well. So let's say that our individual has taken something, they're acting okay, they're not having trouble breathing, they're not having a seizure. you can go ahead and call the Poison Center. So here in Indiana, our Poison Center is at IU Methodist Hospital in Indianapolis. It's open 24 hours a day, 365 days a year. There's actually pharmacists and nurses who staff it, and they're trained in poison emergencies as well too. And what they're there for is they are there to help you figure out what's the next step. Is this something that we can deal with at home pretty easy, or is it something that we really need to get into the hospital as well too? And it's really great with the Poison Center. So let's say that the nurse or the pharmacist, when the call is made, says, "Well, you really need to get that person to the hospital." What they will do is they will ask you what hospital you want to go to. And let's say I'm here in Hamilton County. So let's say that you want to go to Riverview Hospital. What they'll do is they'll have you hang up and call 911, and they will call Riverview Hospital here in Noblesville and say, "Hey, this is so and so from the Poison Center. This is what's coming in. This is how you need to treat them." And that's great because what happens is if the healthcare providers in the emergency department have no idea what's going on or how to treat them, it's going to take them a little bit longer to figure out what the next steps are. But the Poison Center staff will actually send them treatment recommendations on how they treat this individual so that treatment can start right when the ambulance brings that person in the door as well too. So this is the number of the Poison Center. This poison number is throughout the continental US. So it's 1-800-222-1222. And what's great about this number is, let's say you go to Washington, D.C. or to California or wherever, and somebody accidentally gets poisoned. You can call this number and it'll take you to any poison center throughout the continental US. Then you can also do the texting as well too. So throughout the US, this is the National Poison Center hotline number. So whatever the closest poison center that you are close to, that center will pick up the number or pick up the call as well too. So another thing is, back in the old days, there used to be a thing that if somebody ingests something, we need to make them throw up. And that's not true anymore. We never induce vomiting unless poison control tells us to do it. And usually they will not tell you to do it. And the reason why is, let's say somebody ingested bleach. Okay. So they drank bleach. Well, that bleach is going to burn on the way down. And if we cause them to vomit, it's going to burn on the way back up as well too. So we never, ever, ever have people vomit unless poison control tells us to do it. And if poison control wants us to have that person vomit, they'll tell us what to do. But again, we never, ever, ever, ever have that person vomit or we force them to vomit. We always want to let poison control tell us what to do as well too. So as I mentioned, calling poison control does not delay time. A lot of times, most of the poisons can be dealt with at home, and we don't need to get that person to the emergency department, or we don't need to call 911. And what's great about the Poison Center is they're going to call you back to make sure everything is okay as well too. But they will be the first ones to say, "Hey, I really think you need to call 911 and get that person to the hospital as well too." And it also saves time and money. So if we can deal with a poison through the Poison Center, that means we're not going to have an emergency department visit, maybe an ambulance visit cost as well too. So again, this is a great service that we have here in the US. But just remember though, if the person is unresponsive, having trouble breathing, they're unconscious, they're acting kind of weird, I want you to call 911 and not the Poison Center. So what happens when you call the Poison Center? So you need to stay calm, right? It's really important to stay calm because they're going to get tons of information for you to figure out what the product is, how much that person took, how much that person weighs, and what the next step is. Okay. So they're going to ask you, what's the person's condition? What did that person take? How much of the product do we think they took? When did it happen? How's the person doing? The weight of the person as well too. Then they'll ask your phone number in case they get disconnected. So what's going to happen is they're going to get all this information for you, put it in a system, then they're going to be able to tell you what the next step is as well too. And it's really important that we are are able to describe that medicine. So this is an example. This is a pill. So we know it's a white pill. And on one side, we have letters and numbers. They're going to ask you that. Then on the other side of the pill, there's a number. So just make sure that we describe that product as best as you can, because the more you describe to them, the better off it's going to be when they're looking for treatments as well too. And this just kind of gives a quick review because a lot of people sometimes forget what a tablet and a capsule is. So you can see a tablet is usually crushed powder. Okay. A capsule would be something that usually has a gel around it, or there's medicine in it that can break open. And you can kind of see the different things. You can see that the gel capsule as well too. You can see the ones that break up in the water or liquid as well too. So just kind of remember they're going to ask you is it a capsule or tablet? Is there gel in the middle of it? Is there liquid in the middle of it? So try and give them as much information as you can as well too. This is another example of a medication. So it may be a different color on your screen, but it's supposed to be cream color. It's divided in the middle. On the top of it, or one side, there's a number. On the bottom, there's a number. Then on the back of it, there's no identifiers. So they're going to put that in the system, and they're going to be able to figure out what medicine it is. As I mentioned, this is where our poison center is here in Indiana. It's at IU Methodist Hospital. They're open 24 hours a day, 365 days a year. They speak multiple languages as well too, and they're here to help us as well too. So some things that we also need to think about when we talk about poison prevention is making sure that we tell our healthcare provider if we're on any other type of medicine. And I made this comment earlier that it's really important that if a person has multiple medicines and multiple physicians, that each physician knows what that person is or their healthcare provider. Also letting our pharmacists know if we're on vitamins or something else, because sometimes those vitamins and other substances can interfere with our prescriptions as well too. And again, you've heard me say this a lot. If we don't need medicine, we need to get rid of it the safe way, because I know a lot of people may have, like Tylenol 3 is a great example, that let's say they injure their hand and they're like, well, I'm just going to keep it in case I need it for something else. Well, we really need to get rid of that product, because if we don't need it, that's putting maybe somebody that we live with who has a substance abuse disorder at increased risk of overdosing. Maybe if we have those little ones around the house and we don't have it locked up, that's a greater chance for them to get a hold of it as well too. So this is how we get rid of old medicine. Well, we can take our medicine and we mix it in coffee grounds or kitty litter and throw it in the trash, right? And I think that's really important. Actually, this weekend is National Drug Take Back Day. So twice a year in April and October, the DEA sponsors a big drug take back day. So you can take your medications to different sites as well too, and they'll take back your medicine as well. So, and a lot of people ask, well, why do we mix our medicine with coffee grounds or kitty litter? And that's to disguise the medicine. We also talk if somebody has like cough medicine, we don't want to pour it down the drain because it gets into the water system or water supply. We want to put our kitty litter, cough medicine, or excuse me, our kitty litter and our coffee grounds in that cough medicine as well too, and make sure that we scratch out our information on the label of the medicine or actually rip it off. Also, we talk about like the package insert that I just mentioned. A lot of times that package insert has our information on it as well too. So we want to make sure that we rip it up or we shred it or take that Sharpie marker and get rid of that information as well too. And one of the things we never ever want to do is flush medication down the toilet, because a lot of times it gets into our water system and it's really hard to get out of our water system as well too. And these are just some examples in my community where we can take medication to. I work a lot with the sheriff's department. So we have the sheriff's department, we have Westville Police Department, we have, CVS, Walmart, Walgreens, Kroger's, Target as well too. And this just gives you an idea of how much medicine here at the Sheriff's Department in Hamilton County we've collected in a month of old medicine that the individuals in the crime lab at the sheriff's department will dispose of the proper way as well too. So again, I keep harping on it, but I think it's really important that if we have old medicine at home and we're not using it, we need to get rid of it as well too. And again, as I mentioned, these are some different um, places where we can take our old medicine to as well. So again, just to kind of review, most poisons can be safely managed at home when you call the poison center. You got to remember this. But again, if they're unresponsive, they're having trouble breathing, they're having a seizure, I want you to call 911 as well too. And this just kind of gives you an idea because a lot of people forget about our pets as well too. And this is from the National Pet Hotline as well. It's also sourced from MedVet as well too. This just kind of gives you an idea of some things that are poisonous to our animals as well too. So just kind of lets you know, especially with the holidays coming up, and a lot of people are cooking, and there's a lot of different food out there. We know that our animals can be accidentally poisoned if they're given some specific foods as well too. So I just think that's something to think about. And if you want to write the number to the pet hotline, the pet poison hotline, it's much different than the human hotline as well too. So what questions do we have out there about poison prevention or poison education that I can answer?
Jim, that was amazing information. I mean, things that I've never even I've never even thought of or crossed my mind.
Oh, you're welcome.
Um, One question, and it goes back to really kind of the beginning of the presentation though,
Sure.
is um, what do you think, or is there a trend that you have seen in what's contributing to the rise in poisonings in the US? I mean, I feel like there's so much more training and information out there than there was
Right.
previously, but we're still seeing that rise in
Right.
poisonings.
And that's a great question, Jessica. I think a lot of times that we see that we're just in a hurry, and people aren't thinking about maybe I need to put this medicine up high, or my little one can't get a hold of it as well too. And we all know that we are having this huge issue still with prescription drug overdose as well too. And we're seeing a lot of people who have substance abuse disorders as well too. And when you look at I did a lot, as I mentioned, with overdoses, a lot with our heroin and fentanyl numbers. A lot of those individuals who start using heroin and fentanyl actually started using a prescription drug. And I think that's really important that if we really don't need that prescription drug, we really shouldn't be taking it as well too. And a personal story is my mom just passed away a year ago, and she had multiple physicians. And I keep making this comment that physician A had no idea what physician B prescribed. And I think those are some things that we really need to be very confident about when we go to our healthcare providers. And also, I think it's really important is that we don't pharmacy hop. And that means where we go from pharmacy to pharmacy. So let's say that your insurance says you can go to CVS. We need to stay at CVS. We don't need to go to Walgreens or Target or wherever because they have all that information. So I just think those are some things that we need to think about. Does that kind of answer your question?
Yeah, absolutely. And I think it's something that um, I think our community and our society is aware of the increase in the illegal substances
Right.
causing overdoses and things like that. But I think something that's really important that not a lot of people think about is how just our regular medications, right? The prescribed
Correct.
medications can play into that.
Right.
And I am so sorry to hear about your mom. I
Oh, thank
appreciate
you.
you
Thank
sharing that
you.
with us.
Thank you.
And I think that's so important that, presentations like this and information like this are shared with our medical professionals also, because
Mhm,
again, having that open communication between one provider and another is
mhm.
absolutely crucial.
Very much so.
Um, so that definitely, no, that definitely answers that question. I do have to say, I had no idea Obviously, I was very well aware when talking about disposing our medications, not wanting to flush them getting into our water system, things like that. But I had no idea about mixing them with kitty litter or coffee grounds. I have never
Right.
heard that before.
Mhm.
And so that was something that I was like, wait a second, wait a second. I had no
Mhm.
idea. So that's definitely something that I am going to be implementing in our household, because we follow a lot of the other steps, but that is definitely
Right.
news to
And I
me.
think, Jessica, you bring up a good point. Like, when we do our spring cleaning, our fall cleaning, and winter cleaning, that maybe it's time that we do that with our medication as well, too. That if we haven't used it, we need to get rid of it. Same thing. A lot of people don't think like vitamins. Vitamins can accidentally be used as a poison as well, too. So I think especially like those of us that have little ones, like gummy bear vitamins or the gummy bear vitamins just look like gummy bear candies as well too. So I think when we do our different cleanings throughout the season, that we really need to clean out our medicine cabinet as well too.
That's an awesome point. I know that I am guilty of not doing that. I'm trying to be better in
That's
our
okay,
house,
but we're
but
making changes. So one
exactly,
step at a time.
exactly. Awareness and then implementing change. So yeah, I definitely agree. And like you said, I think that so many people just forget, especially with our little
Mhm.
ones in our home. Or, if like you said, if you're visiting grandparents or family members or
Mhm.
friends, just so many dangerous things can look so innocent, especially
Very
to a
much so.
child.
And
And
especially with the holidays coming up as well too.
absolutely, with Halloween, and then of course we just kind of dive right into the rest of the year of
Right.
holidays. And so that's something definitely to be aware of, because again, there's so many things that we don't even think twice about as adults that kiddos can get into. And our young ones are thinking that it's just another piece of candy or something to play
Mhm.
with, and it may be something that we think is very innocent, but we can definitely help prevent those situations. So Jim, again, I am so thankful for you and presenting this
You're
information
welcome.
to us today. And I just appreciate everybody that joined us, and took the time to listen and to take notes. You are more than welcome to reach out to Jim Ginder at the Hamilton County Health Department if you have any additional questions, or anything like that on the information presented today. Or you can always reach out to me or anybody at Child Care Answers. Again, Child Care Answers is our local child care resource and referral agency for Hamilton, Hendricks, and Marion counties. All of our services are 100% free of charge, and we can help families find childcare, help families get connected to other community resources. We can put on a workshop such as the one today from Jim, to bring awareness and spread education on multiple different topics. So if you have any further questions about services we can help you with, please feel free to reach out. I would love to get connected to you. And again, Jim, I'm just so thankful for you joining us
Not a
today,
problem at all.
and sharing this really, really great information with everybody.